Hello, this chapter is chapter 9. We are going over pages 97 to 100. So we're starting with the muscles of the head and neck. So there are 7 main groups that are listed here. So 2 of the muscles of the neck discussed are superficial. That means that they're easily palpated on the neck. So you can feel them with your hands or your fingers very easily. These cervical muscles are the sternocleidomastoid mastoid and the trapezius. These muscles can become painful for dental assistants. Now, that's if you're using improper posture. So you need to be careful that you're sitting correctly in your chair or standing correctly when you're assisting. That is something that you will learn with ergonomics in Mod 3, or that you have already learned with ergonomics in Mod 3. Major muscles of the neck that can be palpated are listed here that I went over. Major muscles of facial expression are listed here. So the orbicularis oris or closes and puckers the lips. So that's like if you were going to give someone a kiss. The buccinator, that compresses the cheeks against the teeth and retracts the angle of the mouth, like if you were laughing or sucking. I'm sorry, that's like more of a sucking action. The mentalis, wow, when that raises and wrinkles the skin of the chin and pushes up the lower lip, that would be like if you were pouting and sticking out your lower lip. And the zygomatic major draws the angles of the mouth upward and backward. That's the one like if you were laughing really big with your mouth open. So they're all paired muscles, which means that you have one on the left and the right side, and they originate from the bone and insert on the skin tissue. That 7th cranial nerve is what's going to be innervating all the muscles of the facial expression. Your major muscles of mastication are listed here. The major muscles are 4 paired muscles attached to the mandible that include the temporalis, the masseter, the internal or the medial pterygoid, and the external or the lateral pterygoid. You can see those in figures 9-10 in your book. These muscles work with the TMJ to make all movements of the mandible possible. So we wouldn't be able to eat or talk or anything like that without these muscles. The nerve that innervates these muscles is the trigeminal nerve, or the 5th cranial nerve. So it innervates all the muscles of mastication, and you need to know that. So the 5th cranial nerve is of primary importance for dental assistance. When we look at the muscles on the floor of the mouth, we have the digastric, the mylohyoid, the stylohyoid, and the geniohyoid. They're located between the mandible and the hyoid bone. They have different nerve branches that innervate the muscles of the floor of the mouth. So you can see this in figure 911 in your book, and on page 98, it has these muscles broken down for the muscle, the origin, insertion, the function, and the innervation of the muscles for you. With your muscles in your tongue, there are 2 groups of muscles. There's an intrinsic group that means they're inside of the tongue, and an extrinsic group, which means they're more for the outside. The intrinsic muscles help with shaping the tongue during speaking, chewing, and swallowing, where the extrinsic muscles are for movement and functioning of the tongue. So those extrinsic muscles include the genioglossus, the hyoglossus, the styloglossus, and the palatoglossus. Those can all be found in figures 9-12 in your book. All muscles of the tongue except the palatoglossus are innervated by the hypoglossal nerve. The palatoglossus muscle is discussed with the palate, and muscles of the tongue and the floor of the mouth are attached to the hyoid bone. So the hyoid bone is kind of like a different kind of bone because it's suspended in the back and it doesn't articulate with any other bone. It's suspended in the back of the throat and it's shaped like an inverted Y. So all these muscles are attached to this bone, but this bone doesn't touch any other bone. When we look at our muscles on the soft palate, we have the palatal glossus and the palatopharyngeus. They are innervated by the pharyngeal plexus. And you can see these muscles in figures 9-12. The last thing we're going to talk about are your salivary glands. So your salivary glands are very important with your dental health. They produce saliva, and that saliva is going to lubricate and cleanse the oral cavity. Not only does that help aid in digestion of food because it helps to break down the food in an enzymatic process, but it also helps to maintain the integrity of tooth surfaces through a process of remineralization. What that means is that anytime you put anything in your mouth besides water, anything to eat or drink, the teeth go through a process of demineralization. So the calcium and the phosphate in the teeth are pulled out of the teeth, and when the acids or whatever is in the food or drink hits the teeth, and the teeth are demineralized. When the saliva enters the mouth, the teeth are remineralized through the calcium and phosphate that's in the saliva, and the teeth become stronger again. But then as you put something else to eat or drink in your mouth, they become demineralized again. So the teeth are constantly in a state of demineralization and remineralization. So it's important to have saliva in the mouth for the remineralization of your teeth. Saliva glands are classified by their size as either major or minor salivary glands. So we need those salivary glands so that we don't have dry mouth. And does anybody remember what that term for dry mouth is? It's very important to know that term, and it's called xerostomia. So xerostomia is dry mouth, the technical term. So the number one cause of dry mouth is prescription drug use. So it is a major side effect of drug use, prescription drug use, or any type of drug use is dry mouth or xerostomia. And patients run the risk of increased decay with dry mouth because they don't have the saliva to wash away food or debris to help clean the oral cavity. And they also don't have the minerals to help to maintain the integrity of the tooth surface in the remineralization process. So with the salivary glands, if they're a major salivary gland, they would either be the parotid salivary gland, which the parotid gland, in that passes saliva from the parotid gland to the mouth through a duct called the parotid duct, also known as the Stenson's duct. And you do need to know this path of where the saliva travels through. The submandibular salivary gland releases saliva into the oral cavity through a Wharton's duct, which ends in the sublingual carnuncles. And the sublingual salivary gland releases saliva into the oral cavity through the sublingual duct known as Bartholin's duct. The parotid gland is the largest of the three major salivary glands, but it only provides 25% of the total volume of saliva. The submandibular gland provides 60 to 65% of the total volume, and the sublingual salivary gland is the smallest of the three major glands. It only provides 10% of the total salivary volume. There's an opening landmark on the buccal mucosa for the Stenson's duct of the parotid salivary gland. And that is all that we are going to talk about in this section of the chapter for today. Thank you.